Okay, I thought it'd be fun to share some of my unpopular nursing opinions that I have about being a nurse and patients and all that. And just a little disclaimer, this is lighthearted and fun. This is not supposed to be taken seriously, so please do not be all up in my comments saying that I'm a bad nurse. My first unpopular opinion is I hate bedpans. I do not like bedpans. I would rather a patient just go in the bed on the chucks and me clean them up, or of course like on a bedside commode or something like that, than to use a bedpan. Now, I always offer the bedpan. If someone is saying they need to go, I always offer it. However, I think they're silly. You put a pan under a patient, they poop in the pan, and it literally just all sticks to their butt anyway. It's like pointless. It hurts their bottom. It's uncomfortable. I would rather just clean up a chucks than clean up this smeary bedpan. That goes with briefs as well. I do not like briefs. I think they break down the skin, and people aren't aware when a patient goes in them all the time if you're not frequently checking. And I would rather you just go in the chucks and I clean you up. My next unpopular opinion is I think it is so much easier to change a bed with a patient in it than it is to get a patient out of bed and do a complete bed change after getting them out of bed. Okay, and hear me out on this. I work in the ICU, so the majority of the patients I see aren't really able to get out of bed, or if they do, it's a lot of work to get them out of bed. Now, I will always get patients out of bed. I will. I am not saying that I will not get them out of bed. However, it's just easier I'm so used to changing a bed with the patient in it that I think it's just less work to do it that way. However, that doesn't mean I don't get people out of bed, so don't come for me. My next unpopular opinion, and you probably will disagree with me on this, is I love family members. I don't care if there are 500 of them in the room or one of them in the room. As long as you're not getting in my way and you're being respectful of what I need to do, I don't care how many people are in the room. Ever since COVID, visitor restrictions have been so weird, and we used to just let anybody come in whenever they wanted, and now they're restricted at my hospital. But I don't care if you have 500 family members. As long as I'm able to do my job appropriately and you're out of the way in situations where we need you to kind of step away, I'm cool with it. My last unpopular opinion is I love bedside report. I absolutely love bedside report. I know this is evidence-based. I know that most hospitals tell you to do bedside report, and a lot of nurses don't like it, but I love it. I love that we can talk about the patient right then and there. I can do my assessment with the offgoing nurse right then and there, get it out of the way, and it just makes me feel like I have a head start to my shift when I can do my assessment and whatnot, literally right when I get on. Okay, those are my unpopular opinions. Let me know in the comments if you agree or disagree with any of them.